relationship with, he retired. So I told her, you're gonna have to do some research and locate the right doctor. She went on countless consultations. Every doctor, there was something that was not right, if it was the review, like their before and after, or the reviews, or the doctor's consultation. We were like, nope, gotta keep looking. And she was adamant. She's like, I wanna get them done, I don't care. I was like, no, you're going to wait and locate the right doctor. And she ended up finding this facility, and we saw the doctor's website, the reviews, everything looked good, and the consultations with her. So we come up here and I see the digital billboard, beautiful. We see the exterior of the facility. It looks like the White House. It's absolutely amazing. Then you walk inside the facility, you see the statues, the detail. It's very meticulously done, and somebody like myself who pays attention to detail, I was excited. Then we go into the consultation. This doctor comes in, good looking, tall, has an aura and presence to him, and I was just like, this is going to be the guy. And then the consultation went absolutely amazing, 10 out of 10. Heather had expectations. He was very confident and told her, this is what I can deliver. And he was assertive in those, in his consultation, and which made her comfortable, made me comfortable. And we went through with booking that surgery for Heather, and it came out amazing. I can't wait to have her come out here in a little bit and we can show you those results. But let me introduce my guest before I actually welcome into the show. This is Dr. Lane Smith. He's a known worldwide as a pioneer and leader in plastic surgery. He's a quadruple board certified, quadruple, ladies and gentlemen. That's crazy. He's built one of the most elite practices in the nation and one of the busiest plastic surgeons in the world, performing over 1,500 procedures per year and over 23,000 satisfied patients. Dr. Smith founded Smith Plastic Surgery, which is home to Chic La Vie, a world-class medical spa and surgical institute of Las Vegas, a AAASF certified multi-specialty surgical center. He served as the president of the Las Vegas Plastic Surgery Society and is the only surgeon to have won the Best Overall Patient Enhancement Award twice. He has been voted Best of Las Vegas 17 times and Best Breast Augmentation for the last 4 years in a row. This guy's the man. He's a legend. It's a privilege. It's an honor to introduce Dr. Lane Smith. Thank you for joining us today, sir.
Thank you, Matthew. And that's an amazing introduction. You're really kind. We'll immediately negate the handsome part, but tall, I am tall. I'll admit to being tall. Thank you for the nice introduction.
Did I get everything right? Because I got that all from your website.
You got it.
Okay.
Pretty right.
So Dr. Smith, like I said, it's an honor, privilege. Thank you for having us here today. When did you realize you wanted to be a physician?
Well, when I grew up, my dad was a doctor, and he was actually a psychiatrist, and so I just always wanted to be a doctor from the time I was just a tiny little kid. You just want, you want to be what your dad is. I didn't want to be when I got to medical school, I knew I didn't want to be a psychiatrist, honestly. You got to be crazy to want to do that. But I knew I wanted to be a doctor from just the smallest age.
Oh, that's good.
3, 4. I just never really thought about anything else. This is what Dad does, and it's what I do. And I was the oldest of 10 kids.
Oh,
okay,
wow.
So, and psychiatrists make the least of all doctors. So we were not wealthy. I mean, we grew up kind of very, very middle class. And but I knew I wanted to be a doctor from a very young age.
That's awesome. So were you excelling in school from?
I did really well. I was able to graduate high school at 16. I went into college at that age, which was scary because I was the youngest in my college by a ways. So when I went into college, all the girls were 18. I couldn't even talk to them. I was afraid of them. And I finished college about 18 and a half. And went on a Mormon mission, and then went into medical school. So I was still the youngest in my medical school, even after I'd spent 2 years, doing that. And I just went through there. I was lucky I wasn't wealthy, so I had to go to the University of Utah, which is where I was from. And but then each time I would get the highest scores, maybe be the top in the class, and I got to move up. So then I went up to the University of Texas, and then up to Stanford, and then up to At least I was able to move up in the next level of training to maybe a better training place. Although the University of Utah is a very good medical school, it's actually underrated and a very good medical school. But I was able to work my way sort of up into the more Ivy League schools the hard way, just by getting good scores.
So this is a question as a father, because I have two young boys. They're 7 and 3, and my 7-year-old, he scored actually really high on an IQ test. He's very bright. He was reading at 2 years old.
Oh, wow.
So how were your parents navigating you the
Not
right
at all.
way? Okay.
Not at all.
Wow.
What happened was in 4th grade, they had these things that you had to read, and they went up to 6th grade, and there were little stories, and you had to answer little questions, And I liked reading, so I read through, all of the fourth year ones, or the 4th grade ones in maybe a month. Mm-hmm. And the stories got more interesting as they got harder, and then they got into Greek mythology. That was really interesting for a kid in 4th grade, about Hercules. I read through all those, and I had actually finished the entire 4th, 5th, and 6th grade reading in one quarter. Right. And just because I really liked reading, and one day I'm sitting in my 4th grade class, and this person taps me on the shoulder, and the teacher, she's like, "You've got to go to another class." I'm like, "I don't want to go to another. I kind of like my class." And they're like, "No, you have to go over here to this other class, this advanced class. You can't stay in the normal class anymore. You have to go to this one because you're all done with everything we have to teach you, and you need to." And so I actually was moved into the advanced class, not with my parents. Wow. Parents always push their kids into these classes. I don't think some of the times they deserve to be there. Right. I actually just got pulled into it. I didn't actually really want it. And all of a sudden I'm in the advanced class, but I had to make all new friends and all this. I didn't really want to do that. Right. And then I kind of stayed there like that until I graduated early, and then went to the University of Utah. Nice. So was there any pivotal moments or challenges while you were attaining your degree or after you actually started practicing? Well, I think the most pivotal moment in my career was when I went into medical school. I didn't know what I wanted to be. And so I knew I didn't want to be a psychiatrist like my dad. Actually, I like surgery. Surgery's cool, surgeons are always like the coolest, And so I actually liked ear, nose, and throat surgery. And the reason I liked it is because the patients kind of healed pretty good, okay? Like some surgeons, if you're in oncology and stuff, half your patients are dying, In ENT, you go in and you cure all these people. You take out tonsils, kids are better. Put tubes in their ear, they're better. Fix sinuses, they're better. It's a high cure rate. So I like that, and I went into that. But ENT does overlap with plastics a little bit in the facial area. We have to do facial reconstruction. We have to know how to do rhinoplasties. And so I started doing those things, and I started realizing I really like that. And the main reason I liked it is because in a lot of medicine, taking out a set of tonsils is pretty much the same thing every time. So you can get bored with it. Whereas when you start getting into plastic surgery, it's different. It's different every time. You've got to think about it. You've got to be artistic. It's more challenging. It's more interesting. And so I realized I like that. So then I went and did facial plastics at Stanford. And because I graduated in the top of my class, I was able to go, up a notch. So then I was able to go to Stanford University and do facial plastics there. I did get the highest score in the United States on that exam, the facial plastic exam. I guess I got an award for that. I actually did get the highest score in the United States on the National Board of Medical Examiners for medical students. I was able to do that too, and that helped me get me to Stanford. And on and on. And so I did facial plastics. I really liked that. It was really interesting. It was really great. And then I thought, well, I want to do, I don't just want to do the face. I want to do the whole body. And so then I went to the Mayo Clinic to do my plastic surgery training. So the most pivotal thing, I think, was when I got into ENT, which I really enjoyed. I realized that that I liked the plastic surgery that I had not realized before. I did not know that. Before going to medical school. Never ever thought about being a plastic surgeon. I started doing a little bit of plastic surgery. Awesome. So that's kind of the most pivotal thing.
Well, so what are all the procedures you're doing today here? What can somebody come and get done here?
Well, I'm a surgeon here. We also have Dr. Paul here. Between the two of us, we do almost anything you can do in plastic surgery. The procedures I like to do the most and the ones that I do the most are kind of breast surgeries. Probably done.
Yeah, I saw that. Amazing. Absolutely amazing.
A lot of
I'm
breast
obsessed.
surgeries. I've probably done it among, I'm certainly in the top in the United States for the numbers I've done of breast surgeries. I would be in, right up there.
So one-stop shop. So ladies and gentlemen, you want anything done, come to Smith's Plastic Surgery. They got you covered.
Most things, that's true.
What's your approach, the facilities for patient care, and how do you manage expectations? For example, Heather came in, she was very specific. I want X, Y, and Z. So is there times where you're like, I can't do that? Or like, what happens in this?
There are times when we, I think it's important to talk about the risks. So I do talk about the risks more than a lot of surgeons, I think. I talk a little more about the risks so patients know. Managing expectations is probably the hardest part of our job. You cannot come in and looking like Roseanne Barr and walk out looking like Angelina Jolie, young Angelina Jolie, okay? Right. And some people think they can, So you've got to say, look, we're going to make you better. We're going to make your life better. Quality of your life will improve. Heather is already stunningly beautiful, so this is not hard to make. It's hard to make her more beautiful. That is true. She's already beautiful, okay? But no matter what happens in the surgery, this girl's going to look good, because she looked good way before. Our goal is when we're talking with patients, we can give you improvement, but there are times when I tell them I can't do it, and it's funny. Patients will get very mad. I had a patient send me a picture of her nose from Manhattan. Right? Manhattan. We do a lot of rhinoplasties because they have the ear, nose, and throat, and the clear other end of the country, and there are definitely surgeons in Manhattan, right? So. And she sends me this picture of her nose. She's had 4 rhinoplasties. Her nose actually looks pretty good, and she had kind of unreasonable demands. And I politely said, look, I don't think I can make you happy. To which I get a 1-star review. Don't go to. I've never even seen this patient 3,000 miles away. It's like there's no surgeons in Manhattan, or have the surgeons in Manhattan also turned you down? Well, that's actually what happened, right? Some good surgeons had already looked at it and said, hey, your idea of results are unrealistic.
Right.
And sometimes patients fool you. Sometimes you do surgery on patients who have unrealistic expectations, and it's going to be a hard row for both of you. When a surgeon is more honest and says, hey, I can't do this, it's better for both. But sometimes patients don't like that. But that is one of the harder parts of our job.
Yeah, and that's what I liked about you, because you're very firm and you're confident with what you can provide. And I come from a bodybuilding background where I get out of shape people, and I sell supplements, and they think if they buy my supplements, they're going to get in shape. And then I'll tell you right here on camera, it's only 5% of the game. If you're not working out, you're not eating right, don't buy it. Exactly. I'm not going to put a bad review on my name because you're not listening. And I'm not going to sell you a bag of goods that is not going to work. And then after 30 days, you're mad that the pills didn't get you a 6-pack.
I think you have a very good understanding. We share the same difficulties.
Yeah. So that's what I liked about you. And as far as there's so much new technology coming out, are you up to date?
Oh yeah, I think we're very up to date. We're the first ones in Nevada and probably still the only ones that added hyperbaric oxygen to our treatments. We're the first plastic surgeons doing stem cells specifically, and so we do try to stay up to date. Dr. Paul and I, we always read the Plastic Surgery Journal every month, which is all the latest research. A lot of surgeons, you could put a $100 bill in there, and I have had partners where I put and said, hey, you got to read this new article, this cool thing, and a month later they haven't read it. So we do it because we like it.
Okay.
If you like doing something,
exactly,
then you're going to do it, and you're going to stay up to date, and it's exciting. If you just do it as a job, no, you're not. But honestly, the most exciting thing I think is stem cells right now. Stem cells are kind of the fountain of youth in a way. They're really cool. And we're on the forefront of that here in Nevada, and the only plastic surgeons I know, well, we are the only ones that offer stem cell therapy.
When would somebody use stem cell? I've seen it as far as injuries go. Is there another case
You're
user?
correct. Injury is one of the main things. It turns out, so stem cells are cells that can become other things, okay? So if you think of it, when you're born, you have two cells. You have the cell from your mom, the egg, and the sperm from your dad. And these two cells make everything: hair, eyes, skin, teeth, So these are stem cells. They can become other cells. And as they divide, they start to make other cells. So it's kind of like a tree. There's the trunk and then the branches. The farther down you go down this tree, the less the cells can make. But cells that can make other cells are stem cells. There are just a few places in the adult body where there are some. There's some in your bone marrow, because you've got to constantly remake blood cells, and there are lots of different types of blood cells. There's white blood cells, there's red blood cells, there's neutrophils, monocytes, blah, 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 platelets. So there are stem cells in your bone marrow that make these several different cells. There are stem cells. Surprisingly, there are stem cells in your fat, okay? They're not actually in your fat, they're around your fat. And they're in the collagen around the fat. And these stem cells, surprisingly, they're a higher concentration than anywhere else in your body. So we used to think fat was the worst possible thing in your body. Now we know that's like the coolest thing, okay? Because you can get these stem cells, plus you can use it to reconstruct things. And when you look at a person, honestly, fat's what makes you beautiful, okay? So, you're younger than me, and you've got some fat in your hand here that hides these veins and things. I'm lacking this fat. As we age, our fat right under the skin melts away. As it starts to melt away, you look older. Having fat under your skin makes you look young, So we're realizing fat's like way cooler than you think. We just need to use it right. Put it in the right places. Put it in your bum, put it in your breast, put it in your face, take it out of your waist, grab the stem cells from it, use it to repair things. We used to think that most of your repair came from white blood cells. Okay, now we know actually stem cells will repair things. And then we used to think, well, this is how they repair things. Stem cell floats over to the damaged things and becomes that thing. You have damaged cartilage, it becomes cartilage. Sometimes it does that. Sometimes it just releases little things called exosomes that are filled with DNA and mRNA, and it goes into the damaged cell and reprograms the DNA to repair itself. So super, super cool stuff. I mean, we're just at the beginning of this stuff. When we figure this stuff out all the way, it's going to be amazing. But so repair is one thing you can do. Repair an injury. It's great for joints. I have patients, friends, where they needed to have a surgery on a joint somewhere in their knee or the elbow. We inject stem cells. The stem cells repair it. It's anti-aging. Stem cells will go to the skin, create collagen, elastin.
Ask you something, because you said something about the fat, how we need that. Is it true when you do lipo out of a certain area, your body, it won't come back as strong in the future?
That's correct. That's absolutely correct. So just like when you're a full-grown adult, you don't grow any taller, you don't grow a new finger if you cut it off, although someday stem cells may help us do that. Okay. You don't grow new cells. So fat, when you're an adult, unless you become morbidly obese, the number of fat cells you have are kind of constant, and where they sit is constant, okay? And when you gain weight, you don't grow new fat cells, they blow up, okay? Like a balloon, and when you lose weight, they shrink. So if you have a problem area, say you're a thin woman, and this happens all the time. I'm a thin woman, but I have love handles,
Right.
And in order to get rid of my love handles, I have to starve myself so thin that my face looks awful, my butt looks awful, my legs look awful. To finally get those to go down, this is your problem area. You've got extra fat cells sitting there, and no matter what you do, you can exercise or anything, they're just not going to go away. If we take them out with liposuction, they're forever gone. And so your waist will be narrower forever. That will be a hard spot to gain weight. You can, but it will be hard. If you tend to gain weight, it will go to other areas where the fat cells still remain. So yes, that is absolutely true.
Okay, great. So, I love how passionate you are about your career. That's why you're so successful doing what you do. But what do you do in your free time, and how do you balance your business and your personal life?
Yeah, honestly, I'm horrible with free time. I don't have much. I am a workaholic. This is probably the number one problem that I do have with relationships and in my life. I'm not good at balance. The one thing I do try to do, okay, for myself that I'm very insistent on is I do try to work out every day. Every day but Sunday. I try to work out 6 days a week. I actually swam a mile this morning, and not like slow, I mean hard. I used to be a swimmer in college, so that's the one good thing I think I do, and I'm sure you're big on that.
Yeah.
And it's so good for people. It's good for your mental health, and so I do exercise on a regular basis. Uh, when on the weekends, I do try to spend time, only with my family. So I'm good about that. But during the weekday, I'm horrible. I go to work at 8, and come home at 9 or
Right.
10 or 11. Last night 11:30. So I am horrible during the week. I'm not great with life balance.
Yeah.
You're probably much better than that.
No, I'm the same way. I mean, I work all like very consistent. It's like work all the time. Something I gotta turn off. Like for me, it's computer or shooting content. And now it's like I gotta delegate time for my kids. Like this is my kids' time.
Gotta
This is
set
work
aside
time.
time,
Yeah. But yeah, I mean, when you're trying to build your business, and you enjoy what you're doing. It's not really work.
Not as bad.
And even like with bodybuilding, my appearance, I enjoy it, and it's not like, oh, I need to do it for a photo shoot or whatever it is. I got to take you to the gym. We'll pump some iron,
All
put
right,
some
yeah, we can
muscle
do
on
that.
it. And what are like some of your core values and principles? Like, how did you attain this? Because you have to be extremely disciplined. I always tell people that if it's in business or it's in life or it's with fitness, it's discipline, doing what needs to be done. Sometimes you don't want to do, you're tired. You're working so many hours. You're going to go up the next day. You can't say, no, I'm not doing the surgery tomorrow.
Yeah.
So how do you make sure your values are intact?
Well, that's a really good question. It's funny you mentioned discipline. That's something I actually am pretty good at.
Yeah,
I'm a
absolutely.
pretty disciplined
Yeah,
person. Sounds like you are.
yeah.
To be really fit, you have
Yeah.
to be disciplined. Uh, I've always had a good work ethic since I was young. My dad worked hard, so I think I learned that from him. But I try to follow certain principles. I'm big into Stoicism right now. I don't know if you know about that, Marcus Aurelius, and discipline is a key to discipline sets you free, right? So I'm big on that. I mean, and so I like that kind of Stoic philosophy.
But would you agree with that? It's not somebody that's disciplined. You're disciplining yourself. Like when you're a boss and this is your realm, you have to be hard on yourself to make sure you're doing the right thing. Some people think like somebody else is over there telling you, no, you have to be internally strong to make sure you're doing what needs to be done. And you also have to be your own cheerleader. Sometimes you have to pat yourself on the back. There's nobody there, when you're doing these things. And successful people like me and you, we could talk, you'll relate to each other. And like, I'm going to get to it later, but I think you're an artist. Like the way this place is crafted, I think surgery is an art form. That there's a million plastic surgeons. There's a million artists, right? There's the top and there's the bottom, and you can see when somebody's at the top and the other person that's not. If you're meticulous with everything that you do, of course you're going to look at your patients the same way. They're a piece of art, and you want to make them look better and feel better about themselves. Would you agree with that?
That's absolutely true. I think sometimes, and there are many good plastic surgeons, but sometimes I'm shocked at what plastic surgeons think are beautiful. I'm just shocked. Like, you don't realize that looks ugly. You don't realize that that's not good.
Right.
I mean, I've had to talk to, where they're like, well, we put in implants, we don't really care if they're close together or not. It's like, what? How do you not know that that's awful? How do you not see that? Some people have an eye for beauty and some don't. I think that is one of my good strengths. I did actually do all the interior decorating here. I'd say 90% of it myself.
Wow.
And it wasn't that I'm the world's best interior decorator. I sit down and say, hey, I'm not smart about interior decorating. I've never done that. How am I going to make this look good? Well, I'm good at recognizing beauty and copying. Mm-hmm. Okay, so I just said, well, you know what? Dior stores are kind of cool.
There you go.
So I looked through all the Dior stores. You can get online. It's so cool about the internet, right? I looked through all the Dior stores in the world and stole from every one of them.
Exactly.
I mean, you can't see it here, but like the pillars are kind of the same as some Dior store colored, kind of that silvery faux paint is stolen from a Dior store. The lighting, I actually designed where the lighting goes, kind of stolen from another Dior store, you know, the flooring and the black tile. And, you know, I'm good at stealing
Well,
or
let me tell you,
understanding beauty, so I was
no,
good at that.
that's like people, it sounds simple when you say it, but it's not, because a lot of people don't even, they can't put that together, even to steal something. For example, this is my brand. This logo was stolen from a big professional wrestling group. Their logo is a little bit different, but I just literally change it into my letters and it looks exactly the same. But sometimes the things you like, that's how you can use it for what you want to do.
Well, it's understanding, recognizing beauty. So you recognize that that looked cool.
Yeah.
Say, hey, I like this logo.
Yeah.
It looks good.
Yeah.
I'm smart enough to understand it's good taste.
Exactly.
And then you said, okay, I'll just alter it a little.
Yeah.
You have to alter art 3% apparently to be your own.
Exactly.
That's, you know, so say you altered 3%, it's your own. Okay, I can alter that 3%.
And like, do you have the statue downstairs? And I'm gonna put these in the shots later so people could see it. But there's a beautiful statue in the entrance. So how did you come up? See, like that was, you had to have found an artist
Actually,
for that.
how it came about is I had a patient who was an artist, and he was really good at sculpting. And so I said to him, hey, can you make me a sculpture? And he said, yes. And I did say, can you make it with 3 girls, kind of like this?
Yeah.
So I gave him the general outline. I said, I want it to look like this. He made it. It looked really good. I saw the, you know, the preliminary thing. I said, but you know, the boobs are all flat, okay? They don't have very big boobs, okay? Because
And
they're
you're
all
like,
kind of
yeah.
like ballerinas, you know? Or gymnasts,
And you're like,
you know?
big boobs is my thing. We
Yeah,
gotta
so
have big boobs.
I said, look, you don't have to make them giant.
Yeah.
You have to make them a little
Yeah.
bigger. So he made them all a little bigger, and then we ended up with this really nice.
This looks awesome.
Statue. Yeah, it is
Yeah.
really awesome.
And then you have a painting over here, very beautiful painting. Who was that? The same artist? Or
No, it was a different. You know, we found that in Park City, and I thought, oh, that was really cool. That artist is very popular. That art is actually somewhat expensive. But.
Yeah, very detailed, and I love that. You know,
Well,
so
right.
that's
And
amazing.
that's the same with plastic surgery. You kind of have to do that, you know. I mean, there have been times when we've had a surgery completely done,
Yeah.
and you know you're finished, and you look and you're like, this side doesn't quite match that side, okay. And you're like, damn it, you know. And you got to go back, and a lot of guys will just see like, oh, that's good enough, you know.
Right,
Like,
yeah.
oh, okay, we got to redo that.
Right. Yeah. Well, that's what makes you. That's why you have this place. That's
Well,
what
that's
makes
kinda
it.
nice, you know, that and hard work. Yeah.
Exactly. Did you ever have any inspirations, if it was when you're in school or now, anybody you looked up, and it could be a doctor, anybody?
People I look up to. Again, like I said, I kind of like to not too many doctors. I had a few doctors that were big in my life. I had Dr. Brennan. He was president of the Facial Plastic Society. He was real big in my life. And then I had Dr. Good at Stanford University. Was one of my professors there. He was really big in my career. I try to look at also people with good character, so I'm like really into Marcus Aurelius right now, the philosopher king of the Emperor of Rome, who was just like this the coolest guy ever, you know. And then people are going to hate that I say this. They're going to hate that I say this, but then I also look up to Jesus. Okay.
Oh, absolutely. Nobody hates
I wish that and Jesus and I are not. I'm nothing like him. I wish I was. You know,
Right.
I'm working there. So I'm not going to give any impression that I'm anywhere near where I need to be in that situation, but I'd like to be more like those people.
I love it. If you weren't a plastic surgeon, what do you think you'd be doing?
I'd be an airline pilot. I've often thought about it. I thought it'd be so fun to be in these big jets, go travel all the time, you know, see new things. I thought, yeah, if I hadn't been a doctor, I would have been an airline pilot. I think I would have liked that. I
Nice.
like traveling. That is one thing I do in my spare time. I do like to travel. I do like to travel to really cool places. If I'm going to take a week off work, I'm going to go someplace really cool.
And I mentioned this to you earlier. I think you're an artist, and you said you agree with that statement. So you're, you know, with your patients, you're an artist. Your facility, you're an artist. Are you like that at home too? Like
Yeah.
where you're always doing everything?
Yeah, I try to do that. You know, I try to do. You know, there is some. You know, at home I do paint occasionally. I used, you know, when I was younger, I used to write music and be in a band. So art is important to me, and I think that's what drew me into plastic surgery. The design of my house is the same way. I kind of try really hard to design it um, and make it look kind of like here, nice and all that. Even the landscaping, I designed the landscaping here and the landscaping at my house. So,
Oh, wow.
again, you sit down and say, hey, I'm not the world's smartest person at this, but I can see someone else's stuff, and I can learn from them, copy them, understand what looks good, and make it look good.
Well, I guess the next interview we have to do at your house because we have to see what you did over there.
My house will look much better with Heather and you, both of you. So yeah, we should do that.
What do you have any goals when you attain this success? You are still working hard. Do you still put list short-term goals, long-term goals for yourself?
Yeah, I try to do that. I'm sure you do that too. To be successful, you've got to have short and long-term goals. Right now my goals are to move the stem cell thing a little more forward because I'm so excited about it. We are probably looking to add another plastic surgeon and then get the MediSpa going a little better. I've set goals in terms of with my surgeries to try and get even a little better. I kind of set these goals like, hey, I don't want to have, set goals like I won't have any unhappy patients for the next 6 months. And then, it's an impossible goal, but you try to.
Absolutely. Babe, come in real quick.
Oh, I wanted to know this in the podcast.
Yeah,
okay?
yeah.
You obviously see how beautiful Heather is, okay? You're going to have to keep working out. Okay? Let me tell the camera something. This is going to embarrass the heck out of Heather, okay? Okay, as beautiful as she is outside, I want everyone to know she's equally or more beautiful inside. That is absolutely true. I swear. Gospel truth. She's as beautiful inside as she is outside. That's not common. That's not common.
Yeah,
a lot of times when women are very beautiful on the outside, they're very shallow on the inside. This is not Heather.
Yeah.
That's so you're gonna make me cry.
Well,
So-
yeah, again, because you're a nice person.
I wanted to wrap it up with showing Heather to you guys. Amazing job by Dr. Smith. It was an honor, privilege to be here with him today. So I appreciate it. Look forward to doing
you,
something
Matthew.
with you again in the
Thank you.
future.
All right.
For a consultation, contact Smith Plastic Surgery.